Hi, my name is Greg Wickman. I'm a school teacher for 20 years, and before that I worked on the space shuttle for 15 years with secret security clearance. I've known Dr. Rutner for 25 years, and recently something happened to me in my life that came on slowly. I was only able to sleep on my left side for a few years, and then excruciating pain started happening in the right side of my cheek. So even I was sent to Kaiser, and they did CT scans of my sinus and cavity looking for some kind of infection or illness, and was presented to go to 2 endodontists to see if there was a problem with a root canal situation, and they decided no, that wasn't the problem. And periodontists, I saw 2 of those, and one of them actually ended up doing a pulling back of the gum and scraping of the teeth and laying the gum back down again. Finally, I went back to Dr. Rutner and I said, I'm in such pain. And as I opened my mouth, he said, "My God, Greg, you've got pus coming down out of your skin here, your gum." I said, "I know, I just had one of the periodontists do planing." And he says, "God, we got to see what's going on here." And he proceeded to take the 6th x-ray of 6 dentists and looked at it and says, "Gee, I just can't see anything wrong here." And he said, wait a minute, get out of the chair, come with me. I just got a new toy down later installed in the office here, and it was this brand new CAT scan machine that they've designed for doctors. I got in there and the machine went totally around my head, and 5 minutes later, zeros and ones turned into my skull. And now instead of just the usual x-ray with that machine put on your cheek like that, he was able to rebuild my whole skull and jaw and teeth structure and a root canal job that I had done 3 years before at a different dentist, an endodontist, neglected to fill the 4th canal. He had filled 3 of them, and on the CAT scan it showed up prominently as 3 solid white channels, and the 4th one was blacker than the ace of spades, as the expression goes. And it had begun to infect my whole jaw. He called me on the cell one day before I was going in. He says, "Stop, don't even do it. It's gone too far. Just see a surgeon and have him pull it." And I did that, and after the surgery was done, of course you ask, could you have saved that tooth? And he said, "No, Dr. Rutner was right. There was no saving it. You had to have it pulled." But if that sounds familiar to anybody out there and can save you any kind of pain and suffering, have that CAT scan done so that you know exactly what's going on inside your head. And that's my testimony to you.